In this video, we're going to talk about three main concepts: healthcare literacy, patient education, and telemedicine, and then we're going to kind of connect them all at the end. So first I want to talk about what healthcare literacy is. Healthcare literacy is this concept of how the patient understands and comprehends health information. This is also known as, the reading said, street smarts of healthcare. So what it focuses on is how the patient reads the information, asks questions, how it interprets data, and also how it navigates and how the patient kind of goes through the healthcare system. So one of the ways that you can prove healthcare literacy or show healthcare literacy is how well they complete the registration forms, how well do they understand the home exercise program, or how they understand when to take medications and how to take them as well. And then actually this links to our next concept, patient education, and that one way to improve healthcare literacy is making sure we communicate properly with it, as well as as us as clinicians provide educational resources to them. So moving on to our next topic, patient education is basically what the word is. Patient education is educating the patient about the condition as well as other aspects that are important as part of their health care. I saw this statistic in one of the readings in one of the articles that say 90 million people do not understand health information or do not know how to apply it or act upon it. So that's kind of alarming statistic, and I feel like that shows, we're going to talk about that later, about how it's really important as us as healthcare providers to really communicate well and efficiently and appropriately so our patients can understand what treatments that they need. Of course, some key points about patient education, some tips of the trade, is that it should be at an appropriate level. They suggest a 4th to 6th grade reading level if you are writing it out for them. Also, like, two things are important: design and writing, if you're choosing to do handouts as a way of patient education. For design, the key is it to be visually appealing and overwhelming. I know when I get some handouts, and even now I have past medical knowledge, I don't like it when it's all cluttered and it's all a bunch of sentences and paragraphs. Basically, they want it to be like pictures, include pictures, do not have like white spaces there. We want white spaces, excuse me, to kind of just not have the feeling of being overwhelmed, as well as lists just to kind of break things down. So how you design it, think of it as something easy that they can have it as a quick glance so they can understand it way better. Another thing is writing. Writing is very important with patient education. Word choice is very important. We don't want to do medical jargon throwing them at them. We want to tone down the language a little bit that's more appropriate for them. For instance, again, 4th to 6th grade reading level. So some rules of thumb with this: usually less than 3-syllable words is needed to just provide more comprehension, and use short sentences so when the patient reads it, they have a better understanding of it. The last concept that we're going to talk about is telemedicine. Telemedicine is this new thing that basically it allows doctors to communicate with each other virtually and across the country. So it helps to communicate better with physicians that may have a better understanding about this case or has more expertise about a case with another physician, and also helps deliver optimal care. The video, it had an example of with the children's department in San Francisco. They use it to provide resources to other clinicians about ER pediatric medicine or pediatric dermatology, since there's not that many board certifieds in the area or in the country. So they use that to make sure that they're communicating effectively with each other to help improve patient care. They also can do an initial consultation of a patient if they send in the video of the referring doctor sending in a picture. I had that example of dermatology. And also they use this more as an educational tool for other healthcare providers. So it's like our simulations here, except that they're going to do it over the webcam and have a quick little 30-minute session on the topic so they can stay refreshed and everything. So overall, how these three concepts, healthcare literacy, patient education, and telemedicine, they're basically trying to improve patient satisfaction and improve patient outcomes. If the patient understands what they're doing and what the treatment plan is and what's going on with them medically, they're more likely going to adhere to the program, and that relies on proper patient education. Also, telemedicine, it makes sure that the best optimal care is provided to the physician and to the patient as well. Also, this shows that it's all of these concepts, it's the provider's responsibility to make sure that it's effective. For instance, for patient education, it is our responsibility to make sure we're effectively communicating with them how, about their illness or condition, about their treatment program. It also is our responsibility to, as providers with healthcare literacy, to make sure that they do understand the information, that they're able to comprehend everything, and provide them with the right tools for them to be able to comprehend and make informed decisions about their health. Also with telemedicine, it is our responsibility as providers to take a step and go to another provider to help improve our patient satisfaction and care by asking for more input, because we know that there's other experts out there that can help them. And I just want to leave you with this, is that, again, bringing up the statistic of 90 million people out there do not understand or apply how to apply healthcare information. And this is a really easy fix if we just communicate properly and we provide, make sure that patient education is there, healthcare literacy is there, and also providing kind of like feedback and talking to other healthcare providers through telemedicine to help increase patient satisfaction and outcomes.